Welcome to Public Health Matters, the show that addresses public health issues that matter the most to the citizens of Harford County. Real issues, real people, and the information you need to know.
Hello, I'm Molly Mraz, Public Information Officer for the Harford County Health Department, and your host for today's Public Health Matters. It's the show that takes a closer look at the public health issues that matter the most to the citizens of Harford County. The FDA released preliminary data on the 2019 National Youth Tobacco Survey, stating that 27.5% of high school students have reported using e-cigarettes in the previous 30 days. In addition, there has been an epidemic of severe pulmonary disease associated with e-cigarettes or vaping products across the United States. To date, there have been at least 2,050 cases of lung illnesses and at least 39 deaths throughout the country. This leads us to our topic today, which is electronic smoking devices and vaping. Joining me today are Dr. Fermín Barreto, Senior Vice President and Chief Medical Officer for the University of Maryland Upper Chesapeake Health, and Dottie Ruff, Tobacco Health Educator at the Harford County Health Department. Welcome to our show, and thank you so much for being here today.
Thank you for having us.
Yes. So we felt like it was really important to do a show on vaping just because of so much press about all of the vaping illnesses and deaths that have been kind of sweeping our nation. Dottie, would you just talk about what exactly are electronic smoking devices?
Sure. Electronic smoking devices are a different way of using nicotine. Nicotine is a chemical, a drug that can be extracted from a leaf from tobacco, and it is put in a medium, some sort of solution with chemicals, flavors, and additives. So it is just the nicotine from the tobacco leaf, not the actual leaf, and it is heated, not burned. A cigarette is burned with fire, and a battery is used to heat these devices.
And you mentioned chemicals, which there's a slew of chemicals in cigarettes.
There's a lot.
Same as vaping?
There's a lot. There's not quite as many, but what the chemicals do to cigarettes, we know very well. We are adding them very quickly to vaping devices because we know it makes it more addictive, harsher, stronger, lasts longer, enhances the flavors. And it's working.
Yeah, and Dr. Barreto, you have a prop here to talk about an oil. Do you want to talk about the...
Well, one of the problems with the vaping devices has been the vaping-associated lung disease that we have been seeing. And the CDC has been trying to investigate, and they're beginning to zero in on what is actually causing this. There's a fancy term called lipoid pneumonia, or lipoid pneumonitis, which they saw in relation to people that were using the vaping devices. But now the recent reports are that they believe that a vitamin E acetate compound, which is a diluent, so that just as Dottie was saying, they dissolve the it can be nicotine, but sometimes it can be THC, and actually 2/3 of the vaping-related illnesses have been related to THC pods, which is what they've been using, and that is actually becoming strongly associated with the lung disease that we're seeing in patients. So that's one breakthrough that will be important in trying to improve the safety of our of the community.
And so we'll talk about the lung disease associated with vaping in a little bit, but really quickly before we get too much into it, do you each want to talk about your roles and how each of you are associated with the vaping illnesses? Dr. Barreto, we'll start with you.
Ladies first, Dottie.
Okay, I am the tobacco education specialist in Harford County. I work for the health department, and my primary role is to go out and educate students and the public, parents, teachers, and the community, the hazards of cigarette smoking. Now that has changed over the years to go to other products as well, and vaping, of course, is in the media for the last few years. And we are winning the battle with reducing the number of youth that are smoking because they've picked up a new habit that is more current and cool than actual cigarettes. So I educate people in the hazards of vaping and the products. And anything that is current is very, very important to pass on to people so they can make a healthy choice.
Dr. Brito?
So I see this from a few different venues. I'm an emergency physician by training. I actually am a board-certified medical toxicologist, and I volunteer over at the Maryland Poison Center. So I'm very familiar with the different compounds and toxins, both from the cigarette side. You know, the big problems there was emphysema and cancer. Now we're dealing with these e-cigarettes and what was deemed as even therapeutic to help people get off of smoking. They've been marketing, to the adolescents, and for myself, that has been the most troubling. As a hospital system, we want to care for patients when they're, sick and ill, but we prefer if people are able to stay healthy, and anything that's preventable, we want to take an active role in trying to promote prevention.
So you're very busy, because I was reading your roles and your titles and just how much time you probably don't have in a day, but you're seeing in the emergency room. Can you talk a little bit about what exactly you're seeing in the emergency department, how you know that these are vaping illnesses?
So that's the tricky part. We right now are required to report these to the Department of Health, and the CDC starts looking at these cases, investigates, and tries to confirm it. But as a clinician, we basically try and first rule out a lot of the typical medical reasons that we would see a patient with pneumonia or flu-like illness, which is the way these illnesses would present. So there's nothing special about the way they present. It could look like a common cold, a cough, short of breath, fever. We go through our traditional workups. It can include chest x-rays, CAT scans, sometimes even as far as bronchoscopy. But for the most part, we have to rule out all of the other diagnoses, and then, of course, have a history of the vaping exposure. And then when we combine the two together, we develop a probability of whether or not this patient could actually have a vaping-associated lung disease or lung injury. So, and then from there, that triggers the report over to the Department of Health. Is
there a group of individuals that is most commonly seen in the emergency department, like the demographics, or is it varied?
The range has been, to middle-aged to elderly to very young. Mm-hmm. I mean, and it just kind of matching what we've seen as far as there's those who choose vaping who are maybe trying to actually stop smoking and believe that this was a safer option, and there's many who just trade smoking for vaping, and then the literature is not very clear yet on whether or not this was really an effective therapy. And then there's the adolescents, where because of the mode in which it's both made, concealed, the odor, they're using it for entertainment, for lack of a better word, and with a lack of awareness, they end up causing themselves harm similar to what you see in smoking. Not necessarily, at least right now, we can't tell if there's a cancer risk, but emphysema is a type of lung injury associated with cigarettes. This vaping-associated lung injury is, of course, with these e-cigarettes, is causing its own damage and causing some real harm to some young patients who shouldn't have this type of disease.
Right. Go ahead.
One of the things we're also noticing with this illness is it's happening faster and younger. People are not old when they're getting the disease after been vaping for a very long period of time. Some of these people that are getting these illnesses have not been vaping very long. Mm-hmm. So it's happening faster. So it's a little more alarming.
And then if somebody's diagnosed with a disease related to vaping, is it a disease that, or if like pneumonia, can be cleared quickly? Or will it have long-term effects? Like, will it eventually be a chronic disease that the person has to deal with?
So time will tell a little bit, because we're just making these diagnoses now. But suffice to say that similar to emphysema, when the lung suffers an injury, your body has an ability to compensate, but it can lead to definitely longer-term disability, for lack of a better word. Mm-hmm. continued shortness of breath, and things of that sort. We're still even trying to learn how to best treat this disease, which is not quite clear to us. We revert back to a lot of we treat it like a chemical exposure, essentially.
Which is what? How would you treat that?
Making sure there's no infection, steroid therapy, although we're not even sure if that necessarily helps, and then supportive care. So if you have a lot of secretions, things like that, or if you have wheezing, we'd start treating those symptoms as well.
Okay. And then Dottie, so you mentioned about the increase in e-cigarette use in schools. And there's a study reported that cigarettes are kind of out and vaping is like the new thing. Why do you think that is?
A couple of reasons. One is it's new, not knowing that it's bad, believing it's better than cigarettes, and the flavors, the more crazy the name of the flavor, the more enticing it is for many youth to try it. And the unknown, just the unknown of not knowing that it's bad and believing something that is different.
Is the problem with e-cigarettes is the THC, right?
Right.
That's the problem. So
Well,
then
it's twofold. Remember, it's it's dissolved in. Then actually, we've had problems with nicotine because
Okay.
there's high concentration pods with a high amount of nicotine, or the mechanism is off and it heats things up. Think of it like you're boiling water. You know, if
Okay.
you have the burner on low, you don't see that much in the way of vapor. You have it on high, vapor's really kicking, right? So some of these mechanisms are not, they're not very dependable, if you will. And we've had nationwide, there's case reports of patients being sick because of the nicotine, which can cause nausea, vomiting, even seizures. And then the THC, of course, is a real problem, and that carries all the same problems of the behavioral changes as marijuana, does in our adolescence.
So if it's the THC pod, is that right? If it's a THC pod, is it because it's laced and the people they don't know that it has THC in it, or they are aware that
They're buying it because they know it.
Okay.
Yeah.
And it's not regulated. I mean, it's sold off the street. It's not made by a manufacturer to make it consistent each pod that you buy. It's mostly made off the street, so you don't know what is being added to it. It's not
Right.
consistent.
Don't you think that would be a deterrent rather than somebody who's like wanting to buy that?
I've not been.
I mean, I don't think I could just buy something off the street and then think that would be okay to ingest.
Well,
but that's just me.
But that's unfortunately we see it too often, and
Yeah.
back in the early 2000s there was ecstasy pills, and they made them look cool by putting neat insignias and BMW logos and whatever, and there was a population that literally ate that up. So
Right.
packaging, branding, it all goes hand in hand, unfortunately, with selling these products.
Right. And then also I want to touch upon are you still seeing people in the emergency department that have burns from these devices exploding in their pocket, or
Yeah, I haven't
is
seen,
that kind of old?
I haven't seen too much of that. To my knowledge, I don't know that we've cared for anyone, but that doesn't mean it didn't happen.
Right.
I haven't heard of too much.
That has gone down from what I've read as well, because
Okay.
one of the original problems with the vaping, the batteries were overheating because they're lithium-ion batteries.
Right.
And the other thing is they weren't vented, so the heat from the battery was building up inside the unit, and that was causing them to explode. So now many of the vaping devices have venting holes in them, so some of the heat can escape. So they've fixed some of the problems that cause the burning.
Yeah, but there's still like some safety issues with the devices, right? Can you speak to that?
They're finding, because they're getting smaller. And when things are smaller, the inside part of the device are getting closer to each other. And you're not supposed to put a liquid near a battery. I mean, it forms an acid, and that's what you're inhaling. So the devices and how they're made are a big reason why some of them are blowing up at various times. And people, when they use a vape, they vape for long periods of time. So the battery gets very, very hot. It's not like they vape for a couple of minutes and then shut it off. They're
Right.
vaping all the time, and it overheats. I mean, our computer laptops overheat.
Right.
And think of something that's so much smaller and very, very hot. Plus the chemicals that are in there, in order to get higher doses of nicotine, they add chemicals like benzoic acid. So you don't feel the burning of the nicotine, because nicotine is very acidic and it burns. So by adding benzoic acid to it, you can actually increase the amount of nicotine and not feel those effects. So the kids are doing it longer and longer.
And so then talk about that, because doing, vaping for a longer period of time than smoking a cigarette or a pack of cigarettes, vaping is equivalent to how many?
Well, it is different depending on the amount of nicotine that is in there, which is also the same for cigarettes. That varies as well. But the most popular one right now happens to be the Juul for many youth. It's concealable, it's small. The flavors are way out there and very enticing to youth. And they have added quite a bit of nicotine to it and concealing it by adding this benzoic acid. So the youth don't really realize one pod of a Juul is the equivalent of one entire pack of cigarettes. And we have many youths that are using 2 and 3 pods a day. So they're getting nicotine poisoning.
Yeah.
Yeah, and that's absolutely right, and that affects brain development. Brain development, really doesn't even complete until age 25.
Right.
Some people say that men don't mature until age 40. So, depending on where you are on that spectrum, you're affecting brain development in these adolescents. And then the other thing, when you're talking about heat, the oil that is used and whatever chemicals it has, that is getting heated and put into your lung. And if anybody has squished one of these capsules, and how sticky it is and feels on your skin, that's actually going into your lung. So that is where we're seeing the illness and the injury occur. So you have the drug itself, the nicotine or THC, both of which causing problems, both of which have developmental problems for the brain before the age of 25, addiction problems, and really lack of efficacy, lack of actual effect of being able to get people off smoking. Actually, the World Health Organization came out and said that e-cigarettes is not a method of solving your nicotine addiction problem. So it's really just another mode. There's not a 1-to-1 conversion or 2-to-1 conversion of cigarettes to vaping, except for the amount of nicotine. Lung damage can be after a single vape or chronic vapes. It's difficult to figure out.
Right, like it just takes one time. And
so many. Very powerful.
Right. So I was going to ask about using vaping as a cessation method, and so that is no longer recommended. Is that correct? Is that what you were saying?
We do not use it as smoking cessation. The nicotine patches, gums, medication assisted cessation, that's what we prescribe in our health system. We do not prescribe e-cigarettes or vapes.
Okay. Do you have a different opinion or?
Oh, no.
Same.
No. We mandate proven methods. We don't know the long-term effects of this vaping, and to say that that is a accepted way to get off cigarettes, we don't know in the future what this is going to happen. We know short-term what's happening, and it could be a whole lot worse in the future. So no, we would never recommend this. We always recommend doing an approved method. And at the health department, we do patches, gum, and lozenges, and of course medications are fine for many people as well.
Right. There's your plug, so call us.
Well, and I wonder, as far as banning it from, I know that like for our campus, it's no cigarettes or e-cigarettes on our campus.
As well.
But
Same as
bars,
our campus.
Restaurants, I don't know where we are yet with that, but the e-cigarettes and the vapor emitted from those is still going to be dangerous, and I'm hoping that I don't see it much in the restaurants around here, but hopefully that is maintained, or if there's already a ban, I'm actually not sure.
Yeah, because you think about the secondhand, I'm sorry to interrupt, think about the secondhand vaping, ingesting that secondhand, you don't know right now what that's going to,
well, it's going to be the same risk. I mean, we have to assume it's the same risk.
Yeah. That's scary. It's very scary. Would you say that e-cigarettes is less harmful than smoking cigarettes, or both are dangerous, or what would you have to say about that?
I don't know that. I know that I'm telling my children you're in big trouble if you do either one.
Yeah.
And making sure, for as long as I am, their dad and they're under my roof, that I'm promoting for them to, be aware.
Right.
My one son has asthma. I was like, this would be the absolute worst thing in the world for you to do.
Right.
And just try and make your children as aware as possible. We know the long-term effects of cigarettes, and from emphysema, COPD to cancer. There's a lot of negative known effects of long-term use of cigarettes. Vaping is not quite known. We know there's an initial near-term risk right now, and you can almost consider it a gateway type for nicotine, even if you don't do the THC piece. If you're already doing a pack of cigarette nicotine equivalents, I mean, where are they going to go if they're going to stop the vapes?
Right.
I don't think either one is less of a poison. I think one is more of a known poison in the nicotine, and the vaping, the story is still being written.
So you talk about talking to your kids about it. So if there are parents watching, so 2 questions. One for Dottie, how can you identify a vaping device? But for Dr. Barreto, how do you start that conversation with your kids?
Well, the first thing I asked them, I sat down with them and asked them, do you have friends that vape? And he said yes. And I was like, oh, great. So maybe I was already too late to the game, because he's 14 years old. And I spoke to him last year about it. So I mean, this was in the middle of 7th or 8th grade. So I mean, these kids are starting at very young ages. So start the conversation as early as possible. Make sure that they are aware that there are consequences of every decision that you make. And it goes for diet, nutrition, exercise, nicotine, and vaping, and cigarettes and vaping. I mean, you kind of have to talk about them both now. The cigarettes and the smoke and the smell and the cancer risk. I mean, that's usually pretty easy. Asthmatics. Oh my God, it's like the absolute worst thing you can do to a lung that already has a disease process in it.
Right.
And then the vaping really just has to hit home with and thankfully I think the awareness, the CDC becoming involved, the banning now and treating vapes like cigarettes and above the age of 21 are all very helpful. So just letting them know that there are big time consequences on the high concentration in nicotine, and as well as the immediate consequences of inhaling that smoke.
Right. And as a parent, I'm always just so interested in how other parents explain things to their children, because I feel at times I cannot explain anything. I mean, granted, mine are very young, but just trying to help parents understand how to even begin that conversation.
And it's not a one and done. You can't sit there and say, oh, I had the conversation, I'm done.
Right.
It is, when it comes up on TV, you bring it up. When he has an asthma attack, I was like, just remember this, you can make it worse. I mean, it is a constant refrain that you have to reinforce.
Right. And then Dottie, how can you identify as a parent if your child is vaping?
One more comment to what Doctor said. Vaping is changing. It has changed so much. I was teaching students in Harford County back in 2012 that we saw that this was something on the rise. It was very different, but it is changing. We used to say every year, but now it's changing every week with the illnesses and the symptoms that are coming out and the flavors that are coming out. So the conversation, again, is not a one and done. It is constantly evolving and bringing it up. Now, how would you know? First, the most important thing is to have the conversation over and over with your child. But if you smell something very sweet, a lot of candy smells are masking the vaping flavors. Also, if you notice their behavior changing, could be from the THC, it's an alarm. Doesn't mean something's happening, but to have the conversation, what could this possibly be? Also to be aware as a parent what these devices look like, because they are made to look like very common household or school devices. Like one looks like a thumb drive, one looks like the flavor drops that go into water, or an inhaler, or a pencil sharpener. Many of them look like pens and pencils that could be in your child's pencil case, and they're bringing them to school. the companies that are making these are very keen to gear towards youth. Your father doesn't care what a device looks like. They're doing this to trick kids so they can get addicted to it.
Right, and then how would you differentiate, how would you teach a kid that the media is trying to skew them away from, or to skew them towards vaping based off of their messaging rather than trying to protect them from their messaging and education?
We told people for so long the ingredients that were in tobacco. We know of almost over 7,000 ingredients in cigarettes, and most of them man has added, and we know they're harmful. And the way it was represented was that vaping didn't have these chemicals that were in there. There's much less chemicals that we know of, although it's not regulated yet, so we don't know all of the chemicals that are in there. And so they started saying it was safer. Well, just because it's safer and has fewer chemicals, safer doesn't mean safe, because many of these chemicals we do know are very harmful to our body and the developing brain, especially to youth under age 25.
Right. Did you have anything you wanted to add?
No, I mean, I think the story with vaping will continue.
Yeah.
With the point with the adolescents and making sure that if you run into problems, there's one additional tool that I just want to throw out there for parents.
Yeah.
Especially on the THC side. There's actually urine tests. I mean, if you really get down to, look, you know, you've already run into problems, they've already been exposed, you're trying to get them and you're trying to hold them accountable, there's actually urine tests out there that will also, you know, even if it's at least the threat of it.
Right. Sit on the counter.
Just, you know, there are tools. This is not easy because of all the reasons that Dottie was talking about. It is hard to prove, it is hard to figure out, and if you suspect it, you know, and you want to try and keep your child on the straight and narrow with that, you know, you also have that available.
Right, and kids are so impressionable, so it's just so important for us to give them accurate information. We have about 1 minute left, so I just wanted to see, I know it goes by very fast. I just wanted to see if you both had any kind of closing remarks that you wanted to mention before we end. Dr. Brito, do you want to start?
You know, at University of Maryland Upper Chesapeake Health, we're happy to care for every patient that comes in, care for the community the best way that we can. But we are ecstatic and prefer prevention and promoting health so that you don't need us. It actually doesn't hurt my feelings. And the reason I'm here is because this is a completely preventable disease, and I would prefer that the hospital doesn't have these patients.
Right.
So, you know, if you need help on cessation from if contact your doctor, contact us in the hospital. And if you have adolescents, Dottie, and if you have adolescents, make them aware.
Dottie, can you give us your phone number really quickly so that people can call you for information?
410-612-1781 at the health department, and we can direct you to the right department. My take on this is to educate your children young and often.
Okay.
They're smarter than you think.
Yes. Thank you both so much for being here today. It was a great show. That is all the time we have for today. I would like to thank my guests on today's show, Dr. Barreto and Dottie Ruff. If you would like more information on vaping and other tobacco use, please refer to the resource page after this program and join us next time for another important issue that matters the most to the citizens of Harford County. Thanks so much for watching.
You've been watching Public Health Matters, brought to you as a public service by Harford Cable Network, your county connection.